This is a psychological note, a viewpoint on awareness, understanding, coping, and dealing with autism spectrum disorder. Asperger's syndrome was a condition that was diagnosed on patients previously, but it has now been combined with autism spectrum disorder. After the year 2013, this condition is part of autism spectrum disorder, as doctors did not see a difference between those diagnosed with Asperger syndrome and those diagnosed with autism spectrum. Asperger's syndrome was a condition on the autistic spectrum and is one of the milder and higher functioning forms of autism. Now, going back with autism spectrum disorder, which is the diagnosis that is used, it affects more males than females. There's no cure for it, and the illness is subtle, meaning that it's not easily detected. It is only identification of the illness is only when the person is closely observed. And doctors have categorized it as a neurological developmental pervasive disorder, which affects how the brain processes information received, and is one of many neurological developmental disorders that exist and different illnesses. A person's basic skills to communicate or socialize is impaired, making their relationships with others difficult. Persons with the condition may be affected in a different way. Not two people are alike with the illness. Some are struggling with a learning disability, and others on the autism spectrum may have an average or high IQ, but seem to lack common sense, which may cause social isolation due to others' inability to accept or understand this illness, especially when the persons with the condition does not seem to exhibit any symptoms. In regards to a diagnosis, it's not unusual for a person to grow up as an adult and not know if he or she has autism. In most cases, it's not detected early, and a diagnosis is only given at adulthood. Going to the doctor for labs, it's beneficial for the person to know about the condition and be explained and given a diagnosis. Seeing a psychologist, experience on autism, assessing autism, and also treating autism. Speech therapists can aid in social communication skills. Now, treatment for adults can be very difficult. The best results are when they are at a young age. The cause for this illness, autism spectrum, is not known. It may be hereditary, meaning that the parents pass it on to their child, or some believe that it may be caused at birth. When the child is being born, they believe that in the birth process something happens to the child brain and it causes the illness. But the root cause is not known. Treatment is mainly aimed at improving the social communication and behavioral skills of the individual. Testing for it includes physical tests, mental and emotional tests, often treated by a team of professionals that consist of a primary care physician or PCP, speech therapist, psychologist, psychiatrist, and neurologist, and etc. Therapies for this illness include cognitive behavior therapy, which is highly beneficial for overcoming behavioral difficulties. They are helped to control their anger, trained to cope with depression, fear, anxiety, and other forms of negative emotions. They learn social skills in different social settings, and also they learn social expectations in those settings. They can learn also rules of social interaction and communication. They are taught in a group for visualization, as they need to visualize in order to understand the information that is given to them. And the method of learning these things is memorization. They learn to speak in a normal rhythm and develop a better understanding of the gestures and body language of other people. Educational therapy also is available to help them develop better learning abilities, or they need to know how to learn. Speech and language therapy helps understand the spoken language, improve pronunciation of difficult words, and occupational therapy helps them to deal with problems related to motor skills. That may include, the therapy may include medications, medicine that can control certain symptoms such as aggressive behavior, repetitive behavior, or anxiety. Occupational therapy helps with also irritability, when they are irritated. Supportive environment around them is suggested for treatment and for good results of the treatment. The treatments are in efforts to help them live happy, independent, fulfilling, and productive lives, since there is no cure. But they can learn how to live with this illness. Now, a person with autism spectrum disorder have difficulty with high-level language skills that may include verbal reasoning, problem solving, making inferences, predictions. For example, they are unable to anticipate a partner's feelings or actions. Then problems understanding another's point of view. They can have difficulty initiating social interactions and maintaining interactions. And in regards to these, they lack social interaction. They may avoid mingling with a group. They can rarely start a conversation. Body language is slightly unusual. They do not make eye contact too often, and their facial expressions are very few. They can be obsessed with a few subjects. They speak in a monotonous voice that sounds rigid or lack emotions. They are unable to respond properly to others' feelings, emotions, and when eye contact is made with them, or body language is being used in order to communicate with them, they often miss these signs or this eye contact from others. And this can be like, for example, in a situation when a person is in a relationship, or a person is maybe flirting with a person that has autism, but this is missed by the person with the autism because they do not understand how that language works. They prefer routine or schedules. Disruption of routine can result in stress or anxiety. They may struggle with change, even small changes to their routine. They are set in their ways and have preference for foods at certain times or for doing things in a certain order. For example, changes as a caregiver's haircut or forced to change class that can disrupt uh, their routine, and it can bring them stress or anxiety. They relate it to themselves. Whatever change is being made, even if it's by someone else, um, it doesn't affect them directly. They apply it to themselves, and they can be affected in this way. They have difficulty with conversation, and they struggle with recognizing humor or appreciate it. They struggle with sarcasm. Therefore, they will take sarcasm in a literal way, or a joke, they may take it in a literal way. And most things they will take in a literal way. Also, not only take it in a literal way, but when doing things for themselves, they will do it in a literal way. And they will speak, um, or they lack noting voice sound. So the sound in their voice is monotonous. They lack pitch. That may change the meaning of words. So either when they speak in it or when it's spoken to them, they do not understand the change in the pitch. Something that they may struggle with also is inability to pick up on subtle cues, subtle social cues. And that is that they may unintentionally cause offense by these. For example, they may stand too close to another person during a conversation and not realize or recognize that this may be making that other person feel uncomfortable, or that it may be taken as flirting or coming on to the other person. They may not pick up on cues that the conversation topic has changed, and instead may insist on carrying on talk about the things that interest them, especially if they are obsessed with a topic. They may speak over people. They have issues taking turns, or may not pick up on cues that a person needs to leave the group, or they choose an opportune time to speak. They have difficulty interpreting social rules and body language, nonverbal communication. This can lead to confusion or misunderstandings, can lead to difficulty forming and maintaining friendships, a tendency to take things literally also. Cannot be cured, but appropriate intervention and support can help these people with autism develop skills and coping strategies. And some of the autism spectrum may be thinking that um, these mannerisms and nonverbal communication and face expressions that we may use are something that we do as we speak, maybe mechanically. They do not understand that when we conversate and when we speak, that these come automatically with whatever emotion that we are feeling. For example, um, when explaining something, maybe we do use our hands, and that comes everything, the facial expression, the body language, the hands movement, It's all involved in the communication, in the transferring of information, and it's all wired at the same time, for it to happen at the same time, and it comes from the brain. Some people in the autism may be thinking that we intentionally go ahead and do this apart from the spoken word. But of course, we do not do that. It just happens automatically as we speak. Our facial expression will be there, attached to the conversation and the feeling, the emotion that we want to show, along with the hand movements and along with the body language. And it's all working at the same time. For them, this doesn't happen this way. So it might be very difficult for a person on the autism to understand how this um, communication happens. But that is the best way I can explain it. Now, people with autism spectrum disorder may have difficulty with high-level language skills that may include also isolation. They may seek isolation to avoid conversating with anyone, both because of the difficulties in doing so and a fear of being misunderstood. Loneliness can be caused also because of the situation that they go through. So families helping them, understanding the condition, the illness, and teaching themselves in regards to it as how to deal with a person that has in their family members that have autism will be very helpful, and also teaching them to help their family to make requests using visual cues that the person suffering from autism can see to make requests. Now they have speech challenges also, as patients many times lack emotional cues and are unable to perceive it in others. Acceptable intonations are missing. They can also speak rapidly, and in children, they may struggle with appropriate volume. So they may speak loudly and they do not know that their volume is too high and that they are almost yelling, maybe, especially if they are under stress. Now, people on the autism have a difficult time reading expressions or recognizing emotions. So they may not respond appropriately to what other individuals may say or want. And this is a challenge for those who are in relationships with those who are autistic, because especially for us women, we may want to be understood, um, our emotions, our feelings, and this person who is on the autism spectrum disorder will not be able to understand these emotions. So we have to help them visualize it. They have great imagination, so they can use their imagination, and we can put them in a way in our shoes so that they can understand what we're going through. We can explain it to them and they can understand it, and then um, be direct with them and not expect for them to read in between the lines, not expect for them to know what we want and for them to act upon it. But it has to be in a way that they can understand what is needed, why is needed, and how to assist. So depending on the autism form that the person has, the patient can develop normal language capabilities with appropriate psychological and speech therapy. They can learn all facets of communication, nonverbal skills, intonations, meaning that they can be taught to learn the difference between asking something or making a question and the pitch to use for that, and sound, and also when making a factual statement, what is required in regards to pitch and sound, because they cannot tell the difference between a question or a factual statement. And of course, this can make communication difficult, because if you're asking a question and the person does not understand that is a question and may take it as a statement, and they think in a literal way, they are totally, there's going to be disruption of communication, and so conflicts and problems will come about. So maybe using, before asking the person, maybe adding to the question, let me ask you a question, and so that the person will know that that is a question that they need to answer to. And they may have challenges also, or difficulty with body language, facial expressions, and eye contact. These emotions are interpreted, or subtle messages are given by facial expressions sometimes, eye contact, and body language. So, for example, when, if you have heard before, when someone says, I saw my mother and she was looking at me and I knew that I was in trouble. Well, these people with autism will not be able to know if they are in trouble or not, because they cannot read facial expressions. So body language is also used, or eye contact is used when flirting. This will be missed by a person on the autism. When we are sad, upset, depressed, or excited, they will not know when that is happening. So instead of asking them or allowing them to kind of figure what we're going through, it is best for us to speak to them directly all the emotions that we may be feeling. Now, when it comes to these expressions, facial expressions or body language messages that we may send, these are often missed by the person, or they are misinterpreted by the person on the autism. And so because of this, people on the autism spectrum may be mistakenly perceived as being rude, unfeeling, lacking empathy, being uncaring, selfish, and lacking compassion, or lacking pity, or as being not able to share their things, or even their giving their opinion. So this affects, autism affects communication and social skills, but it affects also their relationship with others. In regards to daily life with autism spectrum disorder, a person is recommended to take their labs or do their labs, go to the doctor, the primary care physician, and do their labs, and for them to supplement whatever is needed for them to have their body systems running good. We have different vitamins that affect the nervous system and neurological system, and that can help them with their anxiety, their mood. It can improve it. Besides that, exercise can improve their health, and can improve their sleeping habits, as they may suffer also from lack of sleep due to anxiety and other related nervous related symptoms due to their unbalance in regards to vitamins or supplements that they be missing in their body, and because of their nervous system not working correctly. So exercise will help with that. Eating healthy will help with that, avoiding anything that may increase anxiety. Sleeping as recommended for adults, the hours that are recommended for adults, which is maximum 8 hours, but not more than that. And so the vitamins that they can take, which everybody should take in regards to improving our health, is vitamin D3, which improves mood, how we feel. And experts recommend an intake of 600 international units, or um, you can consult your PCP, because if you are deficient under the level of that is given for adults, then the doctor will give you a recommended vitamin intake. And so um, and so it can be replenished in the body, which is vitamin D is a very important vitamin in the body, which helps how it helps the other systems to work properly, and it assists with the neurological and nervous system. You can get vitamin D3 through the sun, but because we wear clothes all the time, or we are enclosed in buildings all the time, we most likely are deficient in vitamin D3 and we do not know it. And so through the sun, we can get the vitamin that converts into a hormone in the body, but you will have to be practically naked in order for you to take that vitamin in. So it is best for us to take the intake of the vitamin and follow the recommended guidelines that your doctor give you. Something that can be taken along with the vitamin D3 for it to work at its maximum is omega-3, which improves the mood also and improves even eyesight and um, other body members related to the bone tissue. It's improved also by omega-3. Magnesium, potassium, melatonin, ginkgo biloba, calcium, all of those are good to take, and they have to do with the nervous system. And it can help with the anxiety, it can help with depression, it can improve the mood, it can improve the neurological and nervous system. And taking all of these as a combination is very good. Of course, magnesium and melatonin should be taken at night. Magnesium can help with the nerve and muscle function, body tics. And sometimes in the eye it happens that we have muscle tics, and when the eye moves by itself, that's a tic. And so magnesium can improve that and improves sleep, so it should be taken at night. Melatonin improves sleep, should be taken at night right before going to sleep. And you can take melatonin and magnesium at the same time and it will work good. Then potassium can be taken also, but all of these, of course, have to be checked with your doctor, your primary care physician, to see if you have enough of it or if you're lacking. Potassium can help with the nerve transmission, muscle activity, water balance, and your nervous system. And ginkgo biloba oxygenates the brain and the body. increase blood flow and increases memory. But of course, ginkgo biloba have to be taken with relation and in combination with these other supplements. Otherwise, you will not see improvement, and it might even cause miscoordination. So taking ginkgo biloba is very good. It oxygenates the brain and the body, which coordination is something that people in the autism lack. So this will help them with that, as I believe that they lack coordination because of lack of oxygen in the brain. Calcium helps the nervous system, the heart, and the muscles also. So these should be taken under the supervision of your primary care physician. Taking the labs will help to understand how your body is doing and the function, and how the function is doing, how it's working. But all of these that I have mentioned, vitamin D3, omega-3, magnesium, potassium, melatonin, ginkgo biloba, calcium, all of these have to do with the nervous system and improve the neurological system also. They can also assist in bone development and function, which is another way, especially that you can do, but taking it combined is when you will see the best results. And so this is what I have in regards to a psychological note and viewpoint. Awareness on this illness is very important, as many people out there may be suffering from autism, but they may not know it. So being awareness of this existing illness is very important.